Good evening. My name is Ramsey Weaver and I'm going to be giving you a speech about diabetes. So blood, insulin, blood glucose, your pancreas, you need to understand what these words mean if you're going to understand diabetes. In a regular situation, a person consumes food. Your body, your pancreas, then creates a hormone called insulin. The insulin travels to your blood, pulls that glucose out, pushes it into your cells for energy. So in a diabetic situation, when they eat, their pancreas can't make insulin, it can't produce it because the body attacks the pancreas. So they have to substitute and use a manufactured insulin so that they can still get that glucose out of the blood and into the cells. The National Institute of Diabetes and Digestive and Kidney Diseases states that 9.4% of the American population has diabetes. I myself do not, so I'm not speaking from personal experience, however my father does. Additionally, there is a plethora of information found, and we'll be using 5 reputable sources to learn a little bit more about this disease. First, we're going to learn about the types, we'll learn about the signs, and we'll learn about why it matters. So diabetes type 1. This is the type of diabetes that they call the childhood diabetes, because more often than not, it's diagnosed when children are young. In diabetes type 1, your body doesn't produce insulin at all. So you have to manage it with replacement insulin. In a Libyan Journal of Medicine, it states that type 1 diabetes mellitus, or T1DM, is one of the most common chronic childhood illnesses affecting approximately 1 in every 400 to 600 children. So what are the signs of type 1? There's increased thirst and urination, increased hunger, blurred vision, fatigue, unexplained weight loss. And occasionally, the first signs are a life-threatening condition called diabetic ketoacidosis. The symptoms are the breath smells fruity, their skin is dry or flushed, there's nausea, vomiting, stomach pain, trouble breathing, trouble paying attention, trouble focusing. If you notice any of these signs in your young children, it's imperative to get help right away and to bring them to their doctor. Experts aren't sure exactly what causes it, but they do know that genetics play a factor in it. It's diagnosed through a simple A1C blood test. You manage your type 1 diabetes with a syringe and needle, insulin pen or pump, and additionally watching your diet and exercise. Type 2 diabetes. This is more of a later in life onset diabetes. This comes just from lack of proper nutrition and exercise. Also, your race, you can be at higher risk. African American, Hispanics and Latinos, American Indians, Asian Americans, Pacific Islanders, they're all at a higher risk for getting diabetes. In a Hindwani Journal of Diabetic Research, it states type 2 was found to affect 382 million in 2013 and was estimated to raise to 483 million by the year 2013. So in type 2 diabetes, they are producing insulin, they're just not producing as much, or what they're producing doesn't work as effectively. The symptoms are very similar to type 1, increased thirst and urination, increased hunger, feeling tired, blurred vision. It also includes numbness or tingling in the hands and feet, sores that don't heal, or unexplained weight loss. Again, they don't know exactly what causes it. They know your genetics play a factor into it. They know that your lifestyle plays a factor into it. If you're overweight, you are at a higher risk. They manage type 2 diabetes with diet, exercise, and medication. So here's the question. What happens if we don't manage our diabetes? What happens if that glucose stays in our blood and we have elevated high blood sugar levels? That's an important question because many health complications can arise. Some include heart disease and stroke, nerve damage, kidney damage, foot problems, eye disease, gum disease and other dental problems, and sexual and bladder problems. Dr. Natasha Vidic, who wrote for the Medical Gazette, said that you can lower your risk of diabetes by maintaining a healthy weight, eating right, and moving more. It is recommended you lose 15% of your body weight in order to maintain good blood glucose levels. The last type of diabetes is gestational diabetes. This only occurs in women who are pregnant, and it does affect the mother and the baby, so it's doubly important to make sure that you monitor those blood glucose levels. There's not very many symptoms, and so they test everybody who's pregnant between 24 and 28 weeks. And managing your gestational diabetes is as simple as monitoring and keeping an eye on your blood sugar as long as diet and exercise. According to Dr. Chloe Broughton, after your pregnancy, you and your baby are at a higher risk for developing type 2 diabetes, so it's something to pay attention to. In conclusion, I hope that I've taught you a little bit about diabetes so that you understand the disease more. And as always, if you feel like you're at risk for this, it's something you should talk to your doctor about.